Good day, ma'am and sir. I'm Kurt Rosati from BSN13C, and for today's video, I'll be demonstrating wound care. For the assessment, identify patient using at least two identifier. This is to prevent performing a medical procedure to a wrong patient. May buntag, sir. Ako dahil si Kurt Rosati, sir, imong student nurse karon. Karon, sir, kay mag-wound care ta, sir, maghindot ta sa imong samad. Unsay pangalan nato, sir?
Andres Rosete,
Birthday, sir?
September 7, 1945.
Sige, sir. Salamat, sir. Second, reviews the order for irrigation and the type of solution to be used. This is to confirm that the procedure is ordered by a physician. Now I'll be checking the doctor's order. So the doctor is ordered wound care and irrigation for the patient, and also there is a normal saline will be given during irrigation. Third, assesses the patient's level of comfort, offers analgesic at least 30 minutes before the procedure. This is to provide comfort. Since wound care is painful, analgesic is given to alleviate the pain during procedure. Kumusta atong paminaw, sir? Nagangot-ngot ba ang samad, sir?
Oh,
Unsa ka sakit, sir? Rate sa out of 10.
8.
8 kasakit, sir. So, maghatagay kog analgesic, sir. Tambal ni siya, sir, para during sa atong procedure, sir, dili kay sakit, sir.
Oh,
Sige, sir. 4. Reviews medical record for symptoms related to patient's wound. This is to provide more information to the performing nurse. So, as I read the medical record, the patient indicates that the pain scale is 8 out of 10. Number 5, assesses the patient history for allergic to medications, antiseptics, tapes, or dressing material. This is to promote comfort and also to prevent any anaphylactic reaction. Allergy, sir?
wala,
Allergy sa gloves, sir?
wala,
Tapes?
wala,
Sa saging, sir, di ka allergy?
wala po.
Sige, sir. Thank you, sir. For the planning, identifies the expected outcomes. This is to establish a standard in rendering a wound care. Second, administer analgesics as ordered 30 to 45 minutes prior to the procedure. This is done to promote comfort, and also, as what I have mentioned earlier, analgesics can prevent or alleviate the pain during the procedure. Third, educates the patient and the family about the procedure. This is done to promote transparency, elicit cooperation, and also to build rapport. Maglimpyo di ko sa imong samad karon, sir, ha? Maglimpyo ta, sir, para mahibalaan nato ang kahimtang sa imong samad if okay na ba siya or dili.
Oh,
Then magkuha po tag mga test para i-lab siya, sir, para mahibalaan kung naabay infection sa imong samad.
oh,
Number 4, gathers appropriate materials. This is done to promote organization and proper body mechanics. Thus, this is to conserve energy. Prepare the necessary equipment, the water pad, the kidney basin, the tape, the surgical scissor, the normal saline, the gauze pad, and also the PPEs, the hazard bag, and also the alcohol and the pens. 5. Provides privacy, perform hand hygiene, and position the patient appropriately. This is done to prevent the wound from being exposed and to safeguard the client's self-esteem, as well as to prevent infection and promote comfort. Next is for implementations. Perform hand hygiene. This is to deter the spread of microorganisms. Perform hand hygiene. Number 2, forms cup waterproof bag and places nearest the bed. This is to promote organization and avoid spillage from irrigation. The hazard bag near the patient. Magbutang na ko water pad, sir, ha? Para dili
Oh.
tas ito naman, sir. Number 3, applies PPE, uses thorough precautions if needed, discards all dressings and gloves, and perform hand hygiene. This is done to deter the spread of microorganisms and also to protect the healthcare provider from acquiring any diseases or infections. Wear the necessary PPEs, the lab gown, face shield, and the gloves. Number 4, applies clean gloves and perform wound assessment. This is to prevent cross-contamination between patient and healthcare provider, and also for the assessment will enable the nurse to know how he or she will be moving forward. Okay, sir.
Oh.
Okay. Number 5, exposes the area near the wound only. This is to preserve the dignity of the patient and also to provide privacy. This is done to have a proper visualization of the affected area. Irrigates wound with wide open. Attaches 19 gauge of anterior catheter. This is done to enable the healthcare professional to know the amount of pressure during the procedure. Second, hold syringe tip above upper end of wound and over area of being cleansed. This facilitates cleansing of the wound, covering the highest amount of surface area. This also promotes sterile technique. Third, flushes the wound using continuous pressure until solution draining is clear. This is to ensure that debris, pus, and exudates that lurk on the surface of the wound is removed. Sir,
Oh.
tagamay, sir. Okay lang, sir.
Okay lang.
Butang ko, sir, ha?
Oh.
Irrigates deep wound with small opening. Attaches soft catheter to the filled syringe. This is to eliminate the risk of needle stick injury and to ensure that the irrigating solution reaches the deepest corners of the wound. Second, inserts tips of the catheter into the opening. This is to attach the soft catheter to the syringe. Third, flushes the wound using slow continuous pressure. This is to promote a balance between preventing trauma and removing unwanted materials like as debris, exudates, and pus. Number 4, pinches of catheter below syringe while in a place. This is to control the direction of water from the syringe. Number 5, removes and refills syringe, reconnects to the catheter, repeats until solution drainage is clear, This is to ensure that unwanted material from the wound has been cleansed off. Applies clean gloves, cleanses the wound with handheld shower. 1. Perform hand hygiene, apply clean gloves, adjust spray with patient seated, ensure water was warm. This is to prevent infection, direct the flow of the water, promote comfort and vasodilation. Number 2. Showers for 5 to 10 minutes. This is to facilitate adequate cleansing and prevent over-cleansing. Now I am done with applying my gloves, performing hand hygiene, and also wearing my PPEs. This is to protect myself from any pathogens during shower and during irrigating the wound. Now I'll begin. First, you must check the temperature if it's warm or not. Sir, pakipaliw po sir. Okay lang sir?
Okay lang.
Sige. Now I'll begin irrigating or showering the wound. Dries wound edges with gauze, dries patient. This is to reduce moisture and prevent further bacterial growth. Applies appropriate dressing, labels with time, date, and student nurses' initials. This is to provide proper documentation and accountability. Disposes equipment and solid supplies, removes gloves, and performs hand hygiene. This is necessary to prevent the spread of infectious material. Removes mask, goggles, and gown. This is to dispose contaminated PPEs and prevent infection spread. Have patient rate level of comfort. This is to determine the level of comfort that the patient had during intra and post procedure. And also, this promote assurance and patient satisfaction and also identify areas of improvement. Sir.
Alam na. Pero ganun na. Dito na tayo sakit.
Sige sir. Monitor the type of tissue in wound bed. This is to determine whether or not the wound prognosis is good. Evaluate spare wound skin integrity. This is to determine whether or not wound healing is progressing smoothly. Observes for presence of retained irrigant. This is to ensure that wound is adequately cleansed. Records procedure and all findings in the patient chart. This is to facilitate proper documentation. Reports to the healthcare provider any evidence of fresh bleeding, sharp increase in pain, retention of irrigant, or signs of shock immediately. This is to provide the appropriate medical intervention as promptly as possible and to promote a desirable health outcome.